I'm in one of my favorite places, home, where we can put our feet up and experience the sights and sounds that are familiar to us, like watching the birds as they're at the feeder in my backyard, or the sunrise as it comes over the farmer's field behind me. We can be in an environment where we are most comfortable in, and with the people whom we love and who love us most. My name is David Baling. I am the chaplain and bereavement counselor for AdvisaCare Home Health and Hospice. Our home health and hospice services are focused on providing care and support to you and your family in your home. AdvisaCare provides medical services, emotional support, spiritual resources for people who are experiencing a life-limiting illness, such as cancer or heart disease or a myriad of other illnesses. Hospice care manages symptoms so that a person's last months or weeks may be spent with dignity and with quality of life, surrounded by their loved ones. You see, hospice affirms life. Hospice care treats the person rather than the disease. It's family-centered. It includes the patient and the family in its care. It includes our doctors, our nurses, our social workers, home health aides, chaplains, therapists, trained volunteers, who all help to provide the care that you need and the support that your family needs in your home. Hospice works to relieve the symptoms of pain and discomfort, anxiety. We give emotional support and social support, spiritual care to the family and to the patient. We provide that care when you need a full and meaningful life and when it matters the most. Not all hospice care is the same, but we at AdvisaCare are committed to listening to and hearing your concerns, planning our care around your goals and your wishes, to honor your life experiences and legacy, to respect your unique beliefs and philosophy, to respond quickly to any need that you have after hours. We're available 24 hours a day, 7 days a week, to expertly manage your pain and its symptoms, to support your family's needs as well as yours, and to provide support to your family for 13 months after the death of a loved one. You might think, well, when's the right time to talk about hospice care? Now. Now is the best time to learn more about hospice, to ask questions about what to expect. Although end-of-life care can be difficult to discuss, it's best for loved ones and family members to share their wishes long before it becomes a concern. This can greatly reduce the stress that comes at the time when hospice is in need. By having these discussions in advance, uncomfortable situations can be avoided. Instead, family can make informed decisions, reducing the anxiety of not knowing a loved one's wishes, but instead advocate for their loved one. Even before entering hospice, one of our bereavement counselors, social workers, chaplains are available to assist you with those discussions. There are many things that we can say about hospice. Even though it's a fearful topic, it's one that needs to be discussed, because the reality is many patients do better in hospice and even live longer because of the care and the team that surrounds them in their home. There's a greater patient satisfaction. Pain is more controlled. Family has reduced anxiety. There's fewer visits to the emergency room or the hospital because we come to you with our entire team. And there is the opportunity for patients to spend time the way they choose to spend it. There is increased caregiver confidence, and there is less burnout because there's a team of support. No one wants to think about losing a loved one. For the caregivers of a terminally ill patient, however, it's not a matter of if, but when. And when curative treatment is no longer an option, it's time to start thinking about how to make your loved one as comfortable as possible for the remaining weeks and months of their life. It's time to start thinking about hospice care. At AdvisaCare Home Health and Hospice, we are committed to come alongside you and your loved ones with better living. We invite you to call at 231-547-6092 because AdvisaCare provides better living through home health and hospice.